Hey, I'm Dr. V. I'm one of the infectious disease physician at CHI Health Creighton. I know we have been hearing a lot of things about COVID, and I wanted to kind of clarify and give some more information for all of you. When it comes to COVID, I think about it's not I anymore, it's we. How do we keep each other protected and help each other be safe? A little bit more about what is coronavirus, what is COVID-19. It's a virus that is most likely came in from an animal to humans, and now we have this infection. Coronavirus has 4 different strains, and we usually see them in wintertime as part of common cold. But what is new about COVID-19 is it's a novel coronavirus. So it's new. So you and I did not have ever exposure to this, and we don't have any antibodies to this. So that's why it's so novel, and we need to protect each other until we are able to have vaccine or antiviral medications. So how do we keep each other protected from coronavirus? It's really important to do masking, social distancing 6 feet apart from each other, and hand hygiene. So when you're running outside, you don't need a mask if you don't have anybody around you. If you're going to your car, if there's nobody around you, you don't need a mask. But you do need a mask. Let's say you go into the grocery store and there's others around you, then you definitely need a mask. If you're going to the mall, you should wear a mask. Anywhere there's large gathering, there's others around you, it's really important to wear a mask. You're protecting the other person, and they're protecting you. For COVID-19 infection, there's some people are symptomatic. So they know they're sick. They're coughing, they have sore throat, shortness of breath. So that's easy for them to know that they should stay at home and get better. But there are people who are asymptomatic or pre-symptomatic. Asymptomatic is you have the infection but you have no symptoms, so you're unaware. And asymptomatic patients can transmit the infection to others even though they are unaware they have the infection. Pre-symptomatic is that you start developing the infection and you're still spreading the infection, but you're unaware yet. You haven't developed any symptoms. So it's really important because of that. We all need to be wearing masks in large gatherings and around each other. So in classroom, that means it's going to be really important, depending on your district's policy, to follow that and, to wear a mask, hand hygiene, and social distance 6 feet apart if possible. When it comes to children, there have been cases are very low. There have been kids who have gotten severe infection, but those are related to when kids have had comorbidities, health issues. So kids are low risk for getting the infection. However, the adults, like the teachers and staff, are at a higher risk. But how can our teachers and staff members protect themselves? It's going to be wearing a mask and doing good hand hygiene and being able to social distance whenever possible. I would like to describe a case where there were 2 salon employees that were symptomatic. They had masks on, and they saw over 140 customers, and all customers had their mask on, and none of the customers acquired COVID-19 infection. So this shows the importance of masking. So let me show you how to put on a mask properly. First, you do hand hygiene. After doing hand hygiene, you pick up the mask, you put it around your face, around your ears, the ear loop, and you press around your nose if there is a metal component, and you seal the mask this way. And when you want to take off your mask, ideally you should do hand hygiene, touch around your ear loops, and remove the mask. The goal is going to be to keep your hands off your face. I know it's really tempting to touch our face, but it's going to be really important to keep our hands from our face and eyes, especially. When we touch things, you can get the COVID-19 virus on your hands, and if you touch your face, then you're contaminating yourself. So it's really important to do hand hygiene and avoid touching your face. There's been a lot of discussions about kids wearing masks. As an infectious disease physician and a mom of 2 kids, I think masks are okay on kids. The concerns are, will kids retain carbon dioxide? Will they get enough oxygen? And over studies show that is not of any concern. They are getting enough oxygen. And also, this will not affect their learning ability. Kids are able to learn with a mask on, cloth mask or other type of mask. I get that COVID-19 is scary. As an infectious disease physician and mom of 2 children, I understand. But we have 3 simple tools that we could use to keep each other safe and our children. And I think it's going to be really important for us to reinforce washing our hands, social distancing, keeping 6 feet away, and wearing masks whenever possible. And when we're ill, to stay at home and not to come to work. Recovery at home with COVID-19 infection mostly includes lots of fluids, making sure you eat your meals, resting, and when you have fevers, taking anti-fever medication such as Tylenol or ibuprofen. How does COVID-19 spread? It's through droplets. So when somebody is symptomatic or asymptomatically spreading, it's usually most of the time droplets. The droplets are coming from our mouth or coming from our nose. That is why it's really important to wear a mask where we could cover our nose and mouth so we protect each other and we contain those droplets.